On this slide, we see the incisors, canines, premolars, and molars. And what it shows here is that all of the incisors and canines have one root. The first premolar on the top in the dog has one root. The next two have two roots, and the next three have three roots. On the bottom, all of the cheek teeth have two roots, except for the first and the last tooth. This shows you the nomenclature of the teeth in dogs, which we previously reviewed. But what we see here on this slide is the nomenclature of the teeth in relationship to the roots in the adult dog. And so you can see all these teeth in the front in the maxilla have one root, with the first premolar having one root, the next two have two roots, and the next three cheek teeth have three roots. So when you look at the cheek teeth here in the maxilla of a dog, we have one with one, two with two, three with three. On the bottom, all the cheek teeth have two roots except for the last one and the first one. Here we see a labial mount where the teeth are stretched out in a line, and you could see again all the incisors and canines have one root, and on the cheek teeth the first tooth and the last tooth have one root, and everything else has two roots. On the top, all of the incisors, canines, and premolar one have one root, and then we have two with two roots and three with three roots. This is just the same image with the Triadan system, showing you the number of roots on the Triadan system. Regarding the number of roots in adult cat, this is a clear model of a cat's specimen, and all of the incisors and canine teeth all have one root. Now with the cat, they have fewer teeth, and the best way to remember how many roots are in the maxilla of a cat's teeth is the first one has one root, the next one has two roots, the next one has three roots, and then there's a tiny little molar back here that has two roots, but sometimes they're stuck together, and that's what we refer to as concrescence. And then on the bottom in the cat, all of the cheek teeth have two roots. But there is one little difference here in that this is the third and fourth premolar. The first molar has a very large mesial root, but a quite small and slender distal root, which becomes important to know when you're extracting, to be extra careful not to fracture this root during the extraction, because that would be easy to do, and that when you're sectioning this tooth, you're going to have to section it further back because of the asymmetry of the two roots. So why is it important to have a good knowledge of root anatomy? Well, we kind of talked about that a little bit. If you don't know how many roots are present, and you have a diseased tooth and you leave a diseased root in place, it will cause persistence of your deleterious clinical signs, such as facial swelling, bone infections, draining tracts in the gingiva mucosa or even the skin, and this is disconcerting for the owner and the patient. And so here we have an example of a persistent draining tract in the skin of a dog underneath its eye because of a retained infected root tip that was left in place following an extraction of an abscessed upper fourth premolar. And so you would have to take an x-ray, find that root, and extract it to resolve this problem. So it's much better to extract all of the roots initially rather than having a follow-up complication like this.